how are you paid? How is your fee system set up? Who pays the bills? Is it patients? Is it insurance companies? How do you structure costs? I mean, you don't have to get too specific, but whatever you could tell.
Yeah, that's a good question. I went with a typical payer mix type of situation.
Hmm.
So we were probably, 30% commercial, including Blue Cross, 20% Medicare, 10% Medicaid, in Michigan, state funded program. Um, and then you had your workers' comp, maybe 12%. I don't know how my math's doing, but you get the picture. The remainder would be cash. And the rules of engagement or the for each insurance company is a little different. And behind the scenes, they're all going through, their changes throughout the years and who's who and is due and who can do what. And again, very law heavy. They have federal regulations they have to answer to, state regulations. So what I'm saying is, when I had that payer mix, I had to learn the elements of each party I'm dealing with,
Sure.
play by their rules, which turns me into a chameleon of sorts.
Yeah.
I felt like I had to behave different with a Medicare patient versus, a cash patient. I'll give you a really small example. At the time, it was illegal for me to pull out a stethoscope and listen to a patient. Yet some of the Medicare rules, you had to do this, that, or the other thing to treat this patient, yet it would violate this over here. And
Wow.
so we're never held to criticism with that, but that's always in your mind. Um, and some of the bigger ones, like, say Blue Cross, you can only treat this patient so many times for this condition. It's got to be one of these diagnoses. So yeah, that's the finances were tied into a lot of, the hurdles and the elements to satisfy for each one of these payer groups in that payer mix. So I would always love to see a cash patient, but it's a burden for that patient. You know
Sure.
what I mean? So
Yeah.
sometimes a patient has several different types of payer types. They'd come in under Medicare, and then they'd start to translate to Blue Cross, and then when that's exhausted, they translate to cash. But yet, guess what? When you're seeing a cash patient, just by virtue of that person being of Medicare age, you still have to play by the Medicare rules. We all know that stuff.
Absolutely.
So yeah, it's that whole revenue control management and what you're aiming at. I would always go at the lowest hanging fruit to see, to keep the lights on so that I could administer the treatment as I saw.